Hello students, I am Dr. Shafia and today's topic is clinical use of antimicrobial drugs. Before starting the main topic, let's focus on the objectives of today's lecture. We will be learning about the empirical therapy, what are the principles of this therapy, what factors which influence the antimicrobial drug use, how antimicrobial drug combinations act, and the role of antimicrobial chemoprophylaxis. Now, first of all, coming towards the empiric therapy. What is this therapy? Empiric therapy is directed against an anticipated and likely cause of infectious disease. It means the therapy is begun before a specific pathogen has been identified. Now, for every therapy, there is a specific protocol which must be followed in a systematic way, and for empiric therapy there are some steps which must be taken before starting of any therapy. It includes formulation of a clinical diagnosis. After that, we should obtain specimens for lab examination and then formulate a microbiological diagnosis on the basis of our history and clinical examination. And then we must determine the necessity for this therapy. Either we should be given this therapy the either or not, and after these steps we must start the treatment. Now we will discuss about some principles on which antimicrobial therapy is being based, and in this we will discuss about the susceptibility testing, various concentrations of blood, route of administration, serum bactericidal titers, and clinical failure of antimicrobial therapy and the therapeutic response of the patient. Now coming towards the susceptibility testing. The results of susceptibility testing establish the drug sensitivity of the organism, and various methods are used for this. And these include disk diffusion and broth dilution method. And the drug concentrations in blood are also very important, and these must be appropriate, especially when using agents with a low therapeutic index. For example, aminoglycosides and vancomycin. And serum bactericidal titers also prove to be effective in the estimation of the appropriateness of choice of drug and dosage. And as far as route of administration is concerned, in most cases, parenteral therapy is preferred, but some drugs are also effective orally. For example, chloramphenicol and fluoroquinolones. Now, while giving any therapy, we must keep check on the therapeutic response of the patient so that we can anticipate any superinfection or the resistance. And these two things must be addressed properly and timely. And the therapeutic response depends upon the pathogen or the site of infection and the immunocompetence of the patient. And during any therapy, we must keep in mind that failure of this therapy can also occur. And there are various factors which can influence the failure. For example, the problems with the laboratory testings, or problems with the drug or the pathogen or patient, which include poor host defenses, poor tissue penetration of the drug, or any resistance or superinfection against the drug. Now we will discuss about the factors which influence the antimicrobial drug use. There are many factors which influence it. These include bacteriostatic and bactericidal activity of the drug, the post-antibiotic effect of the drug, various elimination mechanisms, the pregnant females and neonate, what precautions we must take while prescribing these drugs to pregnant ladies and neonates, and various drug interactions. Now, first of all, we will discuss about the bactericidal activity. There are many drugs which are bactericidal mainly. These include vancomycin, antimicrobacterial drugs, fluoroquinolones, metronidazole, aminoglycosides, and many others. For these drugs, there is little difference between the concentrations that inhibit growth and those that kill bacteria. These are preferred specifically in those patients with impaired defense mechanisms, and some of these agents, such as fluoroquinolones and aminoglycosides, cause concentration dependent killing. It means that increasing their blood levels increases their rate of action and extent of their effect. While others also cause time dependent killing. It means their effect is independent of their concentration and continues only while levels are maintained above the minimal bactericidal concentration. Next is bacteriostatic activity. As the name indicates, these drugs inhibit the growth of the bacteria. And for these drugs, concentrations that inhibit growth are much lower than those that kill bacteria. These drugs include clindamycin, macrolides, sulfonamides, and tetracyclines. Now, students, we will discuss about the post-antibiotic effect. This is the effect which persists after the drug concentration falls below the minimum inhibitory concentration. And it may be possibly due to the persistence of the drug at the target site or many other mechanisms which are still unclear. And post-antibiotic effect is specifically beneficial for those drugs whose single dose administration is beneficial, and for example, aminoglycosides and quinolones possess concentration dependent post antibiotic effect. Thus, high doses of these drugs given once daily results in enhanced activity and extended effects. And one more thing I would like to clear is that the in vivo post antibiotic effects are much longer than those in vitro. As you know, in vivo means in body, and in vitro means in experimental trials, and it may be due to post antibiotic leukocyte enhancement in the body. The most important thing while giving any medicine is that how this drug will be eliminated from the body. As you all know that the liver and kidney play the vital role in the elimination of many drugs. So in the patients having hepatorenal dysfunction, we must be cautious while prescribing any drug. And impairment in hepatic and renal function necessitates dosage modifications. For example, acyclovir and vancomycin have renal excretion, so we need to adjust the dose before prescribing these drugs to the patients of renal dysfunction. Similarly, hepatic dysfunction can also lead to harmful accumulation of many drugs in the body. For example, antimicrobacterial drugs, which are already notorious for causing hepatic dysfunction. And if a patient is already going through some hepatic impairment, then these drugs may prove to be catastrophic. Similarly, hemodialysis markedly reduces the plasma levels of many drugs. So, the supplementary dosage of these drugs is required in the case of hemodialysis, for example, sulfonamides and aminoglycosides, etc. Now, coming towards the most important topic, we will illustrate how the antimicrobial drugs affect the pregnant women and the neonates, and what precautions should be kept in mind while prescribing the antimicrobial drugs to these two groups of our society. Because many drugs can cross the placental barrier and prove teratogenic, and such drugs are also harmful for the neonates. And examples, there are many examples, but we will uh, throw light on some of them. These include aminoglycosides, which may cause neurological damage, and tetracyclines can lead to bone deformities. Sulfonamides can cause kernicterus by displacing the serum bilirubin from albumin, and chloramphenicol is notorious for causing gray baby syndrome. Now, here I would like to discuss something about the gray baby syndrome. What is this syndrome? It is the condition due to the lack of glucuronidation reactions occurring in the baby, thus leading to the accumulation of toxic metabolites. Because the baby's metabolic system is not that strong that it can metabolize the drugs, so these drugs accumulate in the body. And there are specifically two mechanisms which affect this, and these include UDP glucuronyl transferase enzyme system of infants, especially premature infants, is immature and is incapable of metabolizing the excessive drug concentrations. Secondly, the inefficient renal excretion of the unconjugated drug can occur, and together these two effects can lead to specific signs and symptoms, which include ashen gray color of the skin, cyanosis, hypotension, abdominal distension, vomiting, and many others. Now, coming towards the fluoroquinolones. Fluoroquinolones have harmful effects on the growing cartilage, so these are not advisable to prescribe to the neonates and younger children. While giving any drug, we are concerned about which medications that patient is already taking, because when two or more medicines are taken together, they can interact and can lead to harmful effects. And interactions sometimes occur between antimicrobials and some other drugs such as diuretics or any antiplatelet drugs. For example, rifampin can decrease the effects of digoxin, warfarin, oral contraceptives, propranolol, and quinidine. And nephrotoxicity or ototoxicity can also occur when aminoglycosides are used with loop diuretics, vancomycin, or cisplatin. And there are many other examples. Now, coming towards the drug combinations, in most cases, we use a combination of drugs to achieve the certain clinical effects. And these drugs may be indicated in several clinical conditions, which include emergency situations. We can use these to deter the resistance and mixed infection to achieve synergistic effects, sequential blockade, or to increase the drug uptake of any of some other drug. Now coming towards the emergency situations, it means if a patient comes to us with severe infection, for example sepsis or meningitis, and we are suspecting two or more pathogens, then we give combination of drugs so that we can cover the most possible pathogens. And these combinations can also prove beneficial to delay the resistance, because combined use of drugs is valid when rapid emergence of resistance impairs the chances for cure. For example, in the treatment of tuberculosis, we gave a combination of drugs to achieve the uh, better results. And combinations can also be used to achieve the synergistic effects, because when a drug combination is given, they can give more better effects as compared to that when the drug is given alone. When we want to block some metabolic pathway, and in this pathway we want to block two or more steps, then we give combination of drugs so that these drugs combinedly act to block that pathway. And in some cases there are many drugs which may be inactivated due to certain enzymes in the body, and these enzymes need to be inhibited. And for this purpose we give a drug with the main drug to inactivate that enzyme. And many drugs prove to be helpful for the uptake of some other drugs, so in these conditions we use different drug combinations to achieve the desired results. Now, last but not the least, we will talk about the antimicrobial chemoprophylaxis. And antimicrobial prophylaxis should be used in circumstances in which efficacy has been demonstrated and benefits outweigh the risks of prophylaxis. It means when the benefits are more than risks, only then the chemoprophylaxis should be considered. And there are certain rules and regulations for every therapy, as I already said. So for chemoprophylaxis, that the drug which we are going to use should be directed towards a specific pathogen which we are suspecting, and the resistance should not develop against that drug. And prophylactic use of drugs should be of limited duration. We should not use this for longer durations of time so that adverse effects occur. And conventional therapeutic doses should be used, and it should only be used in situations of documented drug efficacy. It means when we are sure about the efficiency of that drug, only then this drug should be used for prophylaxis, because prophylaxis means we are going to give this drug before the infection occurs, or when we are suspecting an infections, so after surgery or after any medical condition, then we are giving for prophylaxis. There are two types of prophylaxis: surgical prophylaxis and non surgical prophylaxis. And first, we will discuss about the surgical prophylaxis. Senek identified four risk factors for post-surgical wound infection. Senek means study of efficacy of nosocomial infection controls. And they identified four risk factors, which I will discuss. These include operations on the abdomen, operations lasting for more than 2 hours, contaminated or dirty wound classification, and at least three medical diagnoses of the patient. And the patient with at least two scenic risk factors have an increased risk of developing infection and should receive antimicrobial prophylaxis. There are some principles on which antimicrobial prophylaxis should be based, and these include that antibiotics should be active against the common surgical wound pathogens. Antibiotics should have proved efficacy in clinical trials, as I already discussed, and the drug should have the possible shortest course, and it must be least effective and least toxic and most effective. And in those cases in which we are suspecting that the patient may become resistant to that drug, then we must reserve some broad spectrum drugs for this resistant condition. And if all the other factors are equal, then the least expensive agent must be used, so that we cannot burden the patient's economical state, because in our society mostly patients cannot afford expensive drugs. So we must be careful. Now let's talk about the non-surgical prophylaxis. As the name indicates, it means some medical conditions, some medical diseases in which we are suspecting the superimposed infections. We use chemoprophylaxis to prevent those infections and save the patient from the pain of those infections. It includes administration of antimicrobials to prevent the colonization, as well as the administration of drugs following colonization. It means before colonization and even after the colonization, but before the development of the disease. We give these prophylactic drugs to save the patient. It is specially indicated in individuals who are at high risk for temporary exposure to specific pathogens, and in patients who are at increased risk of developing infection because of some underlying disease. Because some immunocompromised patients are at risk of developing many other diseases. So, we give the prophylactic diseases to save the patient from the future infection. Now, I will end with the summary that what we have learned in this topic. And we have learned that antimicrobials have immense role in today's medicine, and one should know the indications, side effects, dose adjustments, and the particular drug interactions prior to prescribing a drug. Hope you will find it useful, and here we end today's lecture. Thank you so much.